Hi everybody. In topic 2.1, we're going to talk about developing therapeutic communication skills. The use of language is really important in what we do. Every conversation creates an opportunity for connection and disconnection, reflection and haste, dialogue and monologue, understanding and misunderstanding, collaboration and instruction, no change and change. So really the power of conversation and use of our language, we can either make a positive effect or we can have a detrimental effect. So the definition of therapeutic communication is communicative interactions which place the person as a central focus. There's one goal in mind, and that's the achievement of health goals, and that's the health goals for the client. A therapeutic relationship starts with a fact-finding mission. You need to get as much information as it takes to help you understand their concern. So you have to have effective listening skills and effective skills in speaking. The purposes of therapeutic communication are information gathering, relationship building as an emotional intervention, and patient education. Remember, the goal of therapeutic communication is to empower the client to achieve maximum health and well-being. It's not like social chit-chat, which primarily means to the healthcare practitioner and the client discuss health, treatment choices, decisions, and evaluate the outcomes. It's to provide a safe place for the client to explore the meaning of illness and to provide the information and emotional support that each client needs to achieve maximum health and well-being. We really want this to be a positive experience. Factors that affect communication. Personal factors. So personal factors affect readiness to engage therapeutic communication. We need to recognize these. Words. Use words that respect clients' spiritual, cultural, personal beliefs, education level. Words that make a client feel less than is damaging. So our nonverbal factors. Be mindful of your facial expressions and gestures. Remember, if there's not congruency between your verbal words and your nonverbal, they're not going to believe you. So what's the easiest way to connect with someone nonverbally? Smile. Client barriers. There's many client barriers. I mean, they could be preoccupied with the pain or discomfort, especially if you're coming across an accident, your first one's on the scene. They're going to be very distracted. They're worried. If it's been a car accident, oh my gosh, what's going to happen with my car? Can't understand medical terminology. Emotionally struggling, feeling judged. You know, those people that are drinking and driving, maybe feeling judged at that time. Defensive, confused by complex messages. Lack of privacy, could have a hearing deficit or a cognitive deficit. And then we ourselves have our own barriers. I mean, we could be preoccupied with our personal agenda. We could be rushing. We could make assumptions about clients' motivations. We could be stereotyping and letting our biases impede our judgment, or our own personal insecurities. We're not in the here and now. We are distracted. Factors that affect communication can be external, internal, and language. So external factors. Privacy, so important. It's really difficult to have a conversation with somebody when there are distractions. Space and personal space. The therapeutic communications social space, is 3 to 4 feet. Give somebody their 3 to 4 foot bubble. Clients experience high anxiety will need a little bit more space. And make sure you want to sit at eye level at all possible. Timing. This probably won't be much as an issue for you when you come onto a scene, but if it's not a scene and you're in perhaps an emergency room with your client, is it the right time to talk to your patient? Noise levels. Oh, there's so many noises. Is that a good distraction? Distractions, calls, pages. Make sure your client is the center of your attention. An unrelated activity in the space can be very distracting. Internal factors. So being preoccupied, stereotyping, focusing on your own ideas may misinterpret the responses from your client. Focus on your client. Dedicate your time to your client and kind of put everything else at the back of your mind. Language factors. A client with poor communication skills may hinder communication. If a client doesn't speak the language you're speaking may hinder communications. Mutual understanding requires both communicators to have some level of competency in a common language. If you don't, arrange for an interpreter or a family member if that's what is available. So physical factors that enhance communication. Leaning forward slightly to a client, nodding to signal that you are hearing client's message conveying is important to you. Sitting or standing posture should be relaxed if possible. Don't cross your arms. The upper part of your body should be inclined toward the client. You're listening. If a client's in a wheelchair, move a chair beside that client or get down to their level. So what does standing over a client in most cases give a perception of? Well, it's a power imbalance. And if you're dealing with a child, definitely get down to their level. Therapeutic listening and communication in the interview. So call the client by name or call the client by which they want to be called. Introduce yourself. Always introduce yourself. Let them know who you are. Let them have a name that goes with your face. Show concern for the client. Convey an attitude of competence and professionalism. Sit opposite, eye-to-eye level. Ask about the chief complaints first. Perform a visual assessment of the client. Be non-judgmental. Use short probing questions. Use simple questions and statements that the patient will understand, especially during the emergency situations that you'll be dealing with. Give the patient time to answer fully. Listen attentively and respond with interest. Don't prejudge what you think the patient's going to say. Use continuers. Ask for more information. Paraphrase important statements just to make sure that you heard what they said. Seek clarification. Verbalize the implied message. That's all about that feedback. Avoid getting off subject. Introduce additional questions if required. Utilize a section of comments in medical history forms. Immediately record the information you take down or that you get from your client. Otherwise, it can get misconstrued. Put ideas in a logical sequence of related material, summarize, and then thank the client. So therapeutic positioning for active listening, yes or no? Well, definitely. He's leaned forward. He's talking to the child, and they're pretty much at eye-to-eye level. Is this one? No. Yawning? He's disengaged already. Now she is actively engaged. She's got great eye contact. She's kind of bent forward a little bit, and she's intently listening. Now, table 9.1 out of your textbook suggests safety, SAAFETY, as principles for preparing to listen for a health professional. So S, schedule an interpreter if required. A, arrange your mind to enable complete focus. That's like getting rid of the garbage that's in your mind. Arrange the seating in a culturally appropriate way and move physical barriers. Familiarize yourself with the history and or culture of the person. E, environmental factors affect effective listening. So remove the distractions as much as possible. T, time alone. And why listen? Why listen? Clarify and understand the purpose of the interaction. Actively listening with good eye contact shows that you actually have a good understanding of meta communication because you are using both verbal and nonverbal communication strategies to foster a therapeutic communication relationship. So it's all about establishing a positive therapeutic relationship and using great communication skills to develop a therapeutic relationship. And that's the end of 2.1. So on to 2.2.